Hi, everyone. It's wonderful to connect with you all today. Today, we're talking about something super important, recognizing the early signs of a stroke. This knowledge can truly make a difference in someone's life. We'll be focusing on stroke warning signs that seniors might miss or dismiss, often attributing them to just getting older. It's crucial to pay attention to these subtle changes. Strokes can be tricky, often presenting with symptoms that are easily overlooked or misunderstood. But if we know what to look for and act quickly, we can help keep our loved ones safe and improve their chances of a full recovery. Early intervention is key. Let's become stroke detectives, sharp and observant, ready to identify any potential red flags. And learn 7 important warning signs every family should know. These signs can appear suddenly, and knowing them could save a life. The first big clue is sudden numbness or weakness. This usually happens on one side of the body, like an arm, leg, or the face. If a senior can't lift both arms equally or their smile looks crooked, act fast. This is a serious warning sign. Next, watch for sudden confusion or trouble speaking. This might be slurred words, mixed up sentences, or not understanding simple questions. If a senior suddenly has trouble speaking clearly, don't wait, get help right away. One of the key indicators that a senior might be experiencing a stroke is a sudden change in their vision. Another sign is sudden trouble seeing. This can manifest in various ways, and it's crucial to pay attention to any complaints or observations about their eyesight. This can be in one or both eyes. Sometimes the change might be subtle, affecting only one eye initially, before progressing to both. It's important to note if the vision issue is isolated to one eye or present in both. It might look like blurry vision, making it difficult to focus on objects or read text. Double vision, where they see 2 images of a single object, or even losing sight, experiencing a sudden dimming or complete loss of vision in one or both eyes. If a senior says they can't see well suddenly, or if they describe any of these visual disturbances, it's important to get help immediately. Don't delay seeking medical attention. It might not just be their glasses needing adjustment. It could be a sign of something more serious requiring prompt diagnosis and treatment. Sudden trouble walking, dizziness, or losing balance is another important warning sign. If a senior trips, feels dizzy, or can't stand up without help, don't think it's just old age. It's important to act quickly. A sudden very bad headache for no clear reason can also be a sign of a stroke. Some people say it's the worst headache they've ever had. If this happens, get emergency help right away. If a senior suddenly can't understand what you're saying, even easy sentences, that's a serious warning. Don't think they're just not paying attention. Call for help. Sudden trouble with coordination, like being clumsy, dropping things, or having a hard time with simple tasks, can also mean a stroke. If you see this, act fast. Strokes can be devastating, but early recognition and action can significantly improve outcomes. We're empowering you with the knowledge to make a difference. One key warning sign is sudden numbness, particularly on one side of the body. This can affect the face, an arm, or a leg. Another sign to watch out for is sudden confusion. The person may have difficulty understanding what you're saying or seem disoriented. Sudden vision problems, such as blurred or double vision, or a loss of vision in one or both eyes, can also indicate a stroke. Watch for sudden balance issues. The person may have trouble walking or feel dizzy and unsteady. A sudden, severe headache with no known cause can also be a warning sign. Difficulty understanding speech or trouble finding the right words to say is another critical sign. And finally, be aware of poor coordination or difficulty with movements. If you observe any of these signs, even if they disappear, it's crucial to call 911 immediately. Every second counts when it comes to stroke treatment. Please share this video with your friends and family. You could save a life. Remember, by knowing the signs and acting quickly, you can be a stroke hero and give your loved ones the best chance of recovery. Let's quickly recap the 7 key stroke warning signs: sudden numbness or weakness, confusion or trouble speaking, trouble seeing in one or both eyes, trouble walking or loss of balance, severe headache with no known cause, sudden trouble understanding speech, and sudden trouble with coordination. Remember, act fast if you notice any of these. Thanks for watching. Be sure to like the video and subscribe to the channel.